Hi everyone. Hello everyone. Welcome to another session of AMA with Dr. Behnam. I really want to thank both Genevieve and Francesca, both here to really help me set everything up. I've got a little more tech, not very tech savvy over the years. Things getting a lot more complicated. So welcome. We have our channel on YouTube. We have our Happy channel, and welcome everyone on my personal channel. Welcome to my AMA. We're going to be talking about hair loss all day today. So thank you for joining us. So again, this is our AMA with Dr. Behnam. I'm the founder of Happy Head. So before we get started, I just want to remind you that this information here is for educational purposes only and is not meant to provide a medical advice or services. This does not establish any patient-doctor relationship. Please do not rely on this information to make any medical decisions. And remember, please discuss the risks and benefits of any treatments with your medical doctor before starting any treatment. So, as you guys know, Happy Head is a topical treatment for hair loss, and we're going to talk a little about it. So, where is Happy Head made? So, Happy Head is actually manufactured in our pharmacy. Our pharmacy is located in New Jersey and also in Pennsylvania. So, it's all the Happy Head products, both oral as well as our topical prescription solutions, as well as all of our shampoos and conditioner and vitamins are made in the USA. How long has Dr. Ben been a dermatologist? A great question. I graduated medical school back in 2004. So I graduated derm residency in 2008. So I graduated 16 years ago, and I've been practicing dermatology for 16 years, and if you count residencies, like 19 years. Why did you decide to become a dermatologist? Oh, great question. So I actually have had a lot of dermatology issues growing up. So first, I had a lot of like acne as a young adult, and I took Accutane when I was a dermatology resident. Also, I have a hair loss condition as well, known as alopecia areata, which is this autoimmune hair loss condition that I've treated myself many times for it in the past, and also have on and off been on like a lot of happy medication as well. We were actually talking about this morning. When after my first kid was born, I was going through a lot of hair shedding due to the stress of having a newborn, and I've been on and off, happy products, oral and topical, over the years. Does Happy have a guarantee policy? I think Happy Head does have a 6 months guarantee policy that if you don't see any hair growth in 6 months, we guarantee it. How many months until I see regrowing my hair is usually 4 to 6 months. So hair loss is not a sprint, it's a marathon. It's not going to happen overnight. And honestly, I would be very skeptical if anyone tells you that you're going to grow your hair in a matter of a month. That usually doesn't happen, even with the prescription products. So we usually say using the prescription product, it takes about 4 to 6 months for you to start seeing results. And sometimes, honestly, up to 12 months to see the best results. How long can I take a break from treatment before I lose my results? Usually about 4 to 6 months. I mean, the many months it took for you to see the results can take you that many months for you to start, losing the results as well. Will I lose results if I switch from oral minoxidil to topical minoxidil, vice versa? So if you go from topical minoxidil to oral minoxidil, you're probably not gonna lose results. If you go from oral to topical, you may lose results because sometimes the lower concentration of topical minoxidil might not be as strong as the oral. Our recommendation is to actually sandwich the two together. So if you're in topical, I will add the oral to basically for better results. Uh, how do I know if it's shedding versus hair loss? So shedding, you're actually gonna start to see real, like when you go like this, you're gonna basically see the hairs basically in your hands. Um, Hair loss could come from multiple different, there are many different causes that could lead to hair loss. So hair loss is the final effect of hair shedding, but there are also some patients that don't shed at all. There's a process known as miniaturization where the hair just it shrinks down, and that could also lead to hair loss. So again, so hair loss is the end effect. So you could either be shed and you end up with hair loss, or you could miniaturize and you could end up with hair loss. So two different ways of getting there. And so oral to topical may lose. Oh, here. So oral may lose results because of topical minoxidil concentration may not be as strong as the oral. Thank you so much for clarifying. Um, at what age does hair loss begin? I mean, well, it could be at any age. It really depends upon your family history, your stress factor, what you eat. Um, um, I've seen as patients as young as 10 or 11 losing the hair, but for the most part, it usually begins like around age 19, 20, 21. Is hair loss more common for men or women? That's actually a very good question. I honestly see a lot in my office, and they're about 50-50. But I think more men experience hair loss. Women could experience it too, but sometimes it may not be as obvious as guys. How often should I derma roll? We actually recommend our patients to derma roll every night, but we recommend doing the 0.25 a depth derma roller. So, and the way you want to do it is basically when the hair is wet, you could just gently roll basically back and forth, and that will cause increased blood flow to the scalp and cause more hair growth. Does derma rolling benefit me if I take oral rather than topical? Great question. Derma roller is still going to benefit you actually, even if you don't use the topical. So I still would recommend it. Does derma rolling? Let me see. So, are any leave-in conditions good for the scalp? Yes, absolutely. I love leave-in conditions actually. First of all, even if you're not using any topical, doing the leave-in conditioners are great, just because it's conditions your hair and your hair follicle and your scalp, which is great. If you do have a little bit of a dandruff, or if you have a little bit of flakiness or even dryness from some of the topical, I still would say using leave-in conditioner that could help you. Does Happy offer oral finasteride? Absolutely, of course we do. We have oral finasteride, and we also have the super capsules, which is oral finasteride combined with minoxidil as well as vitamin D. And we just recently launched the the super capsule ED performance, which is oral finasteride with the generic for sals with tadalafil. So, and the reason why we combine that is because we know finasteride could have a risk of sexual side effects. So, by combining with the ED medication, it has been shown that it increases blood flow to the genital areas, and that will reduce your side effects, the sexual side effects from oral finasteride. I go to the gym daily and sweat a lot. Is it healthy to wash my hair with shampoo and conditioner every day? So look, obviously, if you're sweating, go ahead and wash it every day. I mean, there's no other choice. We usually recommend basically using shampoo every other day. Then you could go to a gym and just wash your hair and not put a shampoo in there. That's also possible. But yeah, but if you need to do it, definitely do it. But we usually recommend trying to shampoo every other day. Sleeping in braids to protect my hair ends. Truth or myth? Myth. Uh, is liposomal stronger than the advanced formula? So the liposomal formula is just topical finasteride combined with topical minoxidil. The advanced formula is topical minoxidil combined with topical finasteride combined with minoxidil. I'm sorry, what is that? The advanced formula is topical finasteride and finasteride and minoxidil. So the advanced formula is stronger than the liposomal formula because it has more ingredients in it. How many pumps should I use for shampoo and conditioner? Should I use more conditioner than shampoo? That's a great question. Um, I That's a good question. I mean, I don't. I mean, obviously, you don't want to over shampoo it. The way I look at shampoos is that there's a lot of chemicals in it, so I want to minimize the chemicals as much as as we could. So I would probably use more of the conditioner than the shampoo, in my personal opinion. Um, is it safe to use hair fiber spray after applying the topical solution? Yeah, just let it dry and then you can apply the hair fiber on top of it. Does it hurt to take both finasteride and dutasteride? So topically, we have it both together. Um, and our patient really haven't had the side effects. There are some patients that orally they'll do 5 days of oral finasteride, 2 days of oral dutasteride. We don't usually prescribe the oral finasteride and dutasteride to the same patient, but we definitely have had patients who use the advanced formula, and they said that's honestly that's the only thing that works for them. Uh, what is red light therapy and is it beneficial to the scalp? Red light therapy is it's basically so there are LED lights in a cap or a hat. And what it does increase the blood flow to the scalp. And look, it does work. Look, the more I see clinical studies on it, the more I'm convinced that it works. So I think it's about like 65%, 35%, so it could work for about 65% of patients. We don't have the red light therapy at Happy yet, but we are getting it. We were actually talking to some of our manufacturers over the weekend about this. And again, is it beneficial for the scalp? Again, it could help a majority of patients, but not all, but it doesn't hurt. How should I treat my dandruff? That's a great question. So dandruff is a fungal form, is fungus, and so we do like to recommend using multiple different antifungal shampoos. So you, like usually like a ketoconazole, cycloprox, Head and Shoulders, T gel, T sal, and alternate those shampoos. And the reason why you want to alternate is because you don't want your body to get used to the same shampoo. Um, and then there's also a topical steroid known as clobetasol. And the steroid will really reduce the flakiness, the itching, and the redness, and that's going to help a lot. And it's recommended to do it twice a day, every day for about a 1 week on, 1 week off. So you could use the steroid on and off, and the shampoo you kind of basically continue it for kind of forever. Happy Head does have an anti-dandruff formula, but I don't think we've launched it yet. But maybe we should just put it on the website, and so if anybody wants to get it, I'll talk to our VP of operations about that. Does caffeine contribute to hair loss? Coffee versus energy drinks. So caffeine does not. Energy drinks that have a lot more other stuff in it. Uh, so I'm not a big fan of energy drinks, but the caffeine itself does not lead to hair loss. How did you come up with the name Happy? Oh, great question. So for months and months, me and my wife and Dr. Sean were thinking about different names. God, I think initially we wanted to call it a couple other names, and then we were walking down the Century City Mall, and I did walk by Happy Socks, and I'm like, wow, we should call it. Oh, we initially wanted to call it Huddy Hair. That's what we call Huddy Hair, but I wasn't a big fan of Huddy. I'm like, I couldn't. So then we walked by Happy Socks. I'm like, wow, like what about Happy Hair? And the Happy Hair was cool. It was a cool name. But then like there's something wrong with it. And then I'm like Happy Head. I mean that was the name. It just came up to it like that night and it stuck. We couldn't get the website for a year, but we finally got the website. But yeah, that's how Happy Head came about. But it took months of just brainstorming just different names. Uh, there was also another name my wife wanted to come up with, but I forgot the name. Uh, so where is your office located? We're located in right outside Santa Monica in West Los Angeles, Barrington and Santa Monica Boulevard on the corner. And Happy Head is located right above where we practice. Why is finasteride dangerous for women under 50? So the danger is that finasteride is a category X, which means that if in any case a female were to get pregnant and they were on finasteride, it's a category X. So it's bad for the fetus. It actually prevents testosterone production. So let's say if you have a male fetus, you could actually prevent like the penis being produced and developed. So that's why we don't prescribe it. There are some other doctors that do it. We are a little more conservative as a company, so we want to be on the safer side. What is spironolactone? Spironolactone is a blood pressure medication that is used off-label for hair loss in females. Is a testosterone analog, which means it will competitively compete with testosterone to bind to testosterone receptor, thus inhibiting the formation of DHT. We use it in females, not typically males. I think it's okay. I mean, I don't think it works that great. I think oral minoxidil is much better. Is dutasteride FDA approved? Yes, dutasteride is FDA approved for prostate conditions and enlarged prostate. It is used off-label for hair loss in males. Do you recommend topical and oral together? Absolutely. I've personally seen many, many patients in our office that when they do topical and oral medications together, they see much better results. It's called sandwiching. They see much better results. And when patients come to me and say, Doc, I've been on oral finasteride for like 30 years and then it's not working. So you know what I do? I add topical finasteride to it. And all of a sudden it just basically just sets it on fire and patients get their hair back again. Should I be taking the supplements if I'm taking oral and topical finasteride? Yes, you should definitely be taking supplements. Like the Happy multivitamin is great, as well um, as doing the vitamin D. But if you take the Happy multivitamin, that already has enough vitamin D. in it. So definitely, I do recommend taking supplements. And if you're a female, I recommend taking the supplements along with iron tablets. No, guys don't have to take iron, but females definitely have to do it. Somebody that asked, "Can I do the oral and topical happy together?" Yes, the bundle works the best. Sandwiching will give you better results. What would you recommend for receding hairline, not only on the crown but also for permanent results? Well, look, obviously, if you want permanent results, hair transplants is the only thing that will give you permanent, long-lasting results. But you have to realize that not everyone's going to be a candidate for transplant. So, and also, even if you do transplant, a lot of people still have to take oral medication to prevent the hair from further receding. Otherwise, you're going to need another transplant in 3 years. So still doing the oral medication and topical is still very important to maintain that hair, even if you get the transplant. Um, does the oral medication affect body hair? Very good question. Typically, oral finasteride does not affect body hair. It mainly affects testosterone, DHT production in the scalp. But oral minoxidil will affect body hair. I don't think most guys mind it, but young females do mind going on oral minoxidil because it could give them a little more hair all over the body. Um, so if you're lighter, like lighter hair, like a lighter skin tone female, usually they get the white peach fuzz, so they don't care. But if you're like Middle Eastern or like Hispanic origin, then they do mind going on oral minoxidil. Great questions. So let's talk about the account page on the Happy Head. So first of all, Happy is a subscription service. The reason why it's a subscription service is because you have to do the medication every day for best results. Consistency is the most important thing, and we make it easy on you guys. So instead of basically ordering on a monthly basis, the product is just shipped automatically to your house. So it just makes it easy to be on the plan, basically to get best results. Can you self-serve online on your account page once you've placed an order and create an account? Yes, you could. So you could basically just get on there, I guess do whatever you want online. So just log in and you could see all the other service options that's available. You can also request to adjust your subscription frequency. So let's say if you don't want to get it on a monthly basis, you want to do it every other month, you could also do that, and also change the refill dates anytime you want. We're here to really cater to you and really take care of you. So anything we could do to make it easier for you guys, we'll be more than happy to do it. Happy Head assigned to a board certified dermatologist who you could contact via a HIPAA secured doctor patient chat. So if you have questions, you could just get online and talk to a doctor who is a board certified dermatologist. I know there are other companies that do similar service as Happy Head, but they have like a nurse do it, which is nothing wrong with it. But we have board certified dermatologists who this is what they've trained, and their specialty is this. We also have a team of hair specialists to answer your basic phone calls. So if there's any issues, please just give us a call and we'll be more than happy to answer them. So the new product, so Happy Head ED Performance. So what it is that, so in the past we've heard a lot of patients basically complain that the finasteride could give them sexual side effects, and we completely understand that, and we listened to our patient. So we came up with the Super Capsule ED Performance, which is finasteride combined with tadalafil. Tadalafil is a generic name for Cialis, which is basically a drug that's very similar to Viagra. So, and we have seen that patients that do the oral finasteride and the tadalafil pill together basically have reduced risk of sexual side effects. That pill also has a combination of vitamin D along with it as well. So, is the ED medication harmful over time? So, Cialis has actually kind of changed the whole world these days. A lot of male longevity doctors, or basically male doctors, are prescribing tadalafil on a daily basis for just men's health. So there's a lot of stuff that's going on with tadalafil. So I think it's actually very safe over a long period, over long term, and other doctors are doing it as well. Is there any age requirement? There's really no age requirement for that one. I mean, obviously, we don't prescribe anybody happier products less than age 18, but there's really no age requirement. Do you recommend microneedling with Happy Topical? Absolutely. I do recommend using the derma roller, the 0.25 millimeter depth. So you could apply the Happy on top and basically gently roll. Does Happy work on African American hair? Absolutely. Actually, in fact, the African Americans have a benefit just because a lot of them basically keep their hair short. So it's actually easier to apply the product and it's easier to do the derma roll. And actually, maybe on our website we should have like a gallery of like different ethnicities using the Happy Head products. We have a lot of before and after photos of those. So topical dutasteride plus the oral super capsule bundle. So the pros of purchasing the bundle is that we've seen when patients do the oral and topical habit together, they just end up with better results. So that's the benefit of the bundle. What is sandwiching? Sandwiching means basically when you do topical and oral together at the same time. That's really what it is. And just when you hit it from both ends, patients typically tend to get the better results. Um, why is dutasteride better than finasteride? So the reason why dutasteride is better is because the enzyme actually inhibits the drug inhibits enzymes 3 times better than finasteride. Number two, it hits an additional enzyme, so you're hitting two enzymes as opposed to one. So in clinical, it's been shown that dutasteride inhibits over 90% of DHT production, whereas finasteride only inhibits 70% of DHT production. Also, in clinical studies, it's been shown that dutasteride just works better than finasteride. And there's some reports that show dutasteride has had or could have lower risk of sexual side effects uh, compared with finasteride. So what are new products that are coming soon? We have our beard product coming. So we have a topical minoxidil finasteride that's coming for the beard area. Um, and what is safe to apply in the beard area? This is very specific designed for the beard. It doesn't have any hydrocortisone in it. Also, we are coming out with our new eyebrow formulation. And so we're excited about those. And we did launch the super capsule ED performance. So that's already on the website. I was actually on the website today and I couldn't find it, but it's right under. It says super capsule ED performance. It's right there. But if you go if you Google Happy Head and go through the ad, you won't see it. So you have to go directly to the Happy Head website because the drop down button does not show up on some of the landing pages. That's what it was. So what is the best terms of finasteride, minoxidil, propecia, pill form or topical? What is more effective? So I think there's some studies that's showing that some of the topical may be as effective as the oral, just lower risk of side effects. I think sometimes doing the oral is just easier to do. So patients are more consistent with it, so thus they see better results. So if there's one that you need to choose, I would choose the Happy Head Super Capsule. I would do the dutasteride, minoxidil, Happy Head Super Capsule. That's what I would do. I always told to dermostamp or microneedle first and then apply the product. What do you recommend? I think both ways are fine. The only reason why I'm recommending apply the product first is because then when you dermostamp, you're pushing the product more in, so you might see better results. What is the ED Performance Super Capsule? What it is, uh, it's the oral dutasteride or finasteride, which is a DHT blocker, combined with tadalafil, which is generic for Cialis, which is an erectile dysfunction medication. So it's kind of like Viagra, but it's a long-term version of Viagra that could be taken every day. So think about this: it's kind of like Viagra mixed with, finasteride, but it's a different version of Viagra, so it's safe to be taken every day. All right, guys, this is great. Thank you so much for joining us this afternoon. Um, and thank you for being a Happy Head fan and a Happy Head customer. We really owe it all to you guys. Really appreciate it. Please take 2 minutes and write a review on us on our Better Business Bureau page or on our Facebook. We really would appreciate it. And our hair team specialists are here to answer your questions. Either please give us a call or basically visit our website, happyhead.com/help, and you could chat directly with one of our agents from 7 a.m. to 5 p.m. Pacific Standard Time. Again, happy growing. Again, thanks so much for our team here and everybody on Happy Head and Francesca and Genevieve who made all this possible. Thank you so much, guys. We'll see you guys next time. Bye bye.